So I had a bone density scan a few weeks back, and I've just got the results. I have osteoporosis. I might be aging a bit, but I'm fit, get plenty of sun, and drink lots of milk. What's going on? Could my autism possibly have something to do with it? Let's have a chat about it. Hi, I'm Phil, a late diagnosed autistic older adult, and it's my goal to advocate for autistic people and in particular those of us who have been diagnosed much later in life. I hope through these podcasts we can cut through the misunderstandings and help older autistic people recognise their true awesomeness. Today I want to talk about an issue that on the surface may seem to be unrelated to autism. That is osteoporosis and bone health, and try to discover whether there is a link back to autism. So, as I said, I've just been diagnosed with osteoporosis. And as I seem to be doing with most things in my life since getting my autism diagnosis last year, I straight away asked the question, could it be in any way related to my autism? So off I went on my little quest, rummaging through the library of shelves that is the internet, and found a few very interesting research articles that seem to speak to this topic. But before we get too far in, I want to make a few disclaimers. Firstly, I'm not a medical professional, so what follows here is just a chat, not medical advice. And secondly, this is a subject that, as far as I can see, has had fairly scant research, so we probably can't draw too many solid conclusions. But let's have a look at some of what has been found. First up, I'm referencing a study from 2019 by Hand, Angle, Harris and Carpenter titled Prevalence of Physical and Mental Health Conditions in Medicare-Enrolled Autistic Older Adults. Seems appropriate to this channel. In this study, the data suggests that osteoporosis is over 4 times more prevalent in autistic adults over the age of 65 than in the wider population. And if we look just at men, this figure rises to almost 8 times that of men in the wider population. Now, as a bit of an aside here, this study looks at the prevalence of multiple conditions in the autistic population as compared to a control population. It highlights many other areas where relative rates in autistic people are significantly higher than controls. I hope to come back to some of these areas in future podcasts, but for now let's just focus on the bones. Now, a further paper by Lipsick, Rodder, Wright and Duckham titled The Determinants of Bone Health in Children with Autism Spectrum Disorder found consistently lower bone mineral content in children with autism compared to typically developing children. And it has also been found that autistic people in general are more prone to hip fractures. Added to this is the fact that autistic adult women are more prone to forearm and back fractures also. Okay, so we have evidence of both lower bone mineral content in autistic children and significantly higher rates of osteoporosis in older autistic adults. So why might this be the case? Lipsick et al. Goes on to discuss possible reasons for this, and they are as follows. Firstly, children with ASD, and by extension autistic people generally, have dietary issues such as selective eating patterns and restricted diets. These eating patterns can cause both reduced calorie intake and compromised nutritional intake, which in the case of compromised bone health might mean a reduction in both vitamin D and calcium, which are needed for bone growth. Added to this is the fact that autistic people are many times more likely to be celiac than the wider population. In my case, I did not receive a diagnosis for my celiac disease until well into my 40s, which meant I had been eating gluten for my entire life up to that point. For anyone with celiac disease, eating foods containing gluten will decrease the bowel's ability to absorb vitamins, minerals, and nutrients from food. Vitamin D, which helps in calcium absorption, is also lower in people with celiac disease. Both of these factors greatly reduce the body's ability to absorb calcium, which has a direct effect on bone formation, particularly through childhood and adolescence, where the foundation of bone growth is laid. Other possible factors that may be at play here are the fact that children with ASD are more likely to have reduced physical activity, which can also influence bone development. Another possible factor in reduced bone density in autistic people is to do with elevated levels of the hormone cortisol. Now, I need to stress here that the following information is not specifically from the autism literature, but seems to follow logically, as the autism cortisol and the cortisol bone health links are individually well established. So I'm linking the dots with the following. Cortisol is known as the stress hormone, as it is produced by the adrenal glands in response to stress. As we've talked about in previous podcasts, this might be in the fight or flight response, which is so familiar to autistic people during meltdowns or shutdowns. But living as an autistic person is a daily struggle of dealing with stress and anxiety as we attempt to navigate our way through a world that is oblivious to our specific needs. And so, autistic people commonly live with elevated levels of cortisol. Now, what we also know about cortisol is that elevated levels over a longer period can be detrimental to bone health. Elevated cortisol suppresses the activity of osteoblasts, which are the cells responsible for the creation of new bone tissue, while also promoting the activity of osteoclasts, which are the cells responsible for breaking down bone. These factors combined results in a decline in bone mass over time. High rates of cortisol can also interfere with calcium absorption in the intestines, which exacerbates bone loss further. High cortisol levels can also disrupt the balance of other hormones like estrogen and testosterone, which can also contribute to bone loss. All this may lead to a higher likelihood of developing osteoporosis. Okay, so we can see there are several risk factors for autistic people that can result in compromised bone health in later life, creating a higher than normal prevalence of conditions like osteoporosis. So what are some of the key things we can do as autistic people to protect our bone health? Well, autistic or not, the same remedies would apply. Firstly, stress management is important. Now, sometimes this might seem easier said than done for any autistic person, where stress and anxiety seem to be so common. Mindfulness, meditation, and regular exercise may all help to lower stress, but many autistic people may find mindfulness and meditation unhelpful. So some other options might include freedom to stim, engaging in special interests, finding quiet spaces, creating predictable routines, but also understanding our boundaries and triggers is key, or even reducing demands or seeking support. Good nutrition is also important, but yet again, for many autistic people, nutrition and eating pose many problems. So again, no easy answer. Obviously, anyone who has a diagnosis of celiac disease needs to be absolutely strict in their adherence to a gluten-free diet, as the tiniest amount of gluten ingested can damage the intestine for weeks or even months, inhibiting calcium absorption. Regular exercise is also critical in maintaining and even improving bone density, with an emphasis on weight-bearing or resistance exercise as the priority. So what are some of the common signs of osteoporosis? Well, to be blunt here, the first sign might be an unexpected fracture from a minor fall or low-impact injury. A slight decrease in height over time may also be an indicator. Or a persistent back pain. Maybe you notice that your posture is more stooped than previously. For me, none of these things happened. The only reason I was diagnosed is that a specialist suggested a precautionary scan because of my celiac disease. So I was lucky to have discovered it before breaking a bone in my back or hip, for example, which would have been not good. So how is osteoporosis diagnosed? Well, osteoporosis is diagnosed by measuring bone mineral density. This is done by doing a low-level X-ray scan with a dual-energy X-ray absorptiometry or DEXA machine. In this scan, you lie on a flat padded table while the operator positions the machine to scan several areas of the body, usually the back, hip and forearm. It takes about 20 minutes and is not uncomfortable. In my case, because of my history with celiac disease, my scan was free under Australia's Medicare system. The results of this scan give a T-score, which is a number on a standardised scale and indicates bone density. -1 or above is normal. -1 to -2.5 indicates osteopenia, or low levels of bone density. -2.5 or below indicates osteoporosis, or severely low bone density. This score then helps predict your overall risk of having a fracture, along with other factors like age, sex, and history of incidents like falls, etc. So in summary, osteoporosis is much more prevalent in autistic people compared to the wider population. The reasons for this increase are varied, but come back to how we respond to our autistic traits consciously in areas such as diet and exercise, but also in how our autism affects the internal functions in our body involuntarily, such as stress and anxiety. Added to this is the high prevalence of conditions like celiac disease amongst autistic people. As stated earlier, I'm not a doctor, so I can't advise you whether to go and get tested. But if any of this resonates with your experience, it may be worth chatting to your primary healthcare provider about your individual situation and have them assess your risk and advise if testing is warranted. And going back to my situation, I am now on vitamin D supplements leading up to blood tests to determine what drugs I can take to treat my osteoporosis. I've also been advised to undertake weight-bearing or resistance exercise to help with my bone strength and stay away from impact sports. Okay, so that's enough for now on bones and autism. Feel free to let me know in the comments if you have had a similar experience with unexpected diagnoses that relates to either bone health or anything else that might link back to autism. And as always, like, subscribe and share for more lived experience of an older autistic bloke. See you next time. Bye for now.